Ba da 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 da. Ba-da-da-da-da-da. Oh, see? Oh, we almost had it perfect there. We just got a little bit of a restart, and that's totally cool. I'm not worried about it at all. Welcome to Confidently Insecure, the podcast where we're absolutely sure we don't know everything. I am your host, Kelsey, darragh, and this week is a good one. Let's see. In October, we know that it's Mental Health Month. We do it every year. We have, doctors, therapists, expert psychologists on. September was Pain Awareness Month. And since this podcast has kind of turned into some form of like therapy and a place to talk about pain, but not like in a pro way, it's just me, your BFF. I figured we could use the real pros from actual BFF therapy on Instagram and in practice. This week's guest, we have Dr. JAIMEE Arnoff. She is partnered with Mariah Seeger DeGeer. They are based in New York. They are BFF Therapy. They are actually best friends and therapists who are also writers and provide culturally competent psychotherapy for youth through adulthood, specializing working with deaf and multicultural communities, which, that's just amazing. I definitely want to touch on that. They do everything from relationships, impact of racism, emotionally focused therapy, talking to children about race and intersectionality and development. But all of that aside, this week we are specifically talking about pain reprocessing therapy, or PRT as they call it for short. So welcome to the podcast, Dr. JAIMEE Arnoff.
Thank you. I think so excited to be here.
I have a clapping sound. There we go.
That's how you clap in sign language.
Clap in sign language, yes. I mean, this is so amazing. Thank you so much for coming. First, tell me how you got involved in mental health and specifically in the communities that you do therapy with.
Sure. Well, the communities, I guess, started first. We had a deaf family friend, and all of the kids were kind of just sent to sign language camp when I'm the oldest in my family. So all of myself and my sisters were sent to sign language camp at like a local high school during the summertime. And we slowly every year just like really built on our American Sign Language communication skills, found our way into the deaf community. When it was time for me to decide what I wanted to do for college, I applied to some deaf studies programs and ended up at Boston University. And as part of that, major, they send you into a school your first year just to learn how to, work within that community and education. And I found very quickly I was not paying attention to the teacher, but I was paying attention to the students. And I didn't care about earth science. I cared about where they were coming from and what their family dynamics were like and what they had for breakfast. And like, did that impact how they were paying attention to what the teacher was saying? And I very quickly was like, I think I should maybe add psychology to what I'm doing here. So I ended up double majoring in psychology and deaf studies at BU.
Wow. And how underrepresented are like deaf psychologists in the mental health community?
Super underrepresented. I mean, there's a deaf university in Washington, D.C. called Gallaudet University. It's been featured on some media shows like Switched at Birth, Deaf U on Netflix. It's starting to find some popularity in just people who are going through the streaming services, but it's mostly for deaf and hard of hearing students. But there are also hearing individuals that attend primarily in their grad school programs. And so I went to their clinical psychology PhD program, and that's where I completed my graduate degree.
Amazing. And if that wasn't already accomplished enough, you had to go in and throw becoming as you called it real quickly offline before we started, becoming a baby pain psychologist. So tell me a little bit about
baby in the field.
Yes. Tell me a little bit about that process. Like what led you to go from already this such accomplished, like niche community driven psychology study into an even more niche underrepresented community of psychology studies?
Yeah, well, I try and use my own experience so that I can better relate to my clients and hopefully experience some of the things they may have already experienced before they've come to me, or kind of fill my plate with other modalities and different research background so that I can kind of wrap them around with the supports they may not have yet had access to, especially as a signing therapist. So that's going to be really important in kind of minimizing some of the preferences in terms of deaf and hard of hearing individuals not wanting to work with an interpreter. The deaf community is really tight knit and small, and so they're worried about their privacy and confidentiality. And so, I have a variety of pain diagnoses myself. I started working mostly with children and adolescents with anxiety and depression, many of whom have thoughts and urges of wanting to hurt themselves or other intrusive ideation. And I slowly started to hear in the local community, but also in the wider community, you know, following people like you and Zach from the Try Guys and people who are just like talking about pain and like just listening to people's journeys and wanting to kind of like my work with high risk clients, talk more about pain and make it okay to do that. And, you know, hearing locally that there's not necessarily providers that have an experience themselves with pain or have just explored the field of pain psychology, which both feels like very rooted in history and also very new. So I, you know, full disclosure and transparency, am very new to this field as a provider. And so that's why I say, you know, I'm a baby psychologist. I'm a baby pain psychologist.
Absolutely.
I'm just kind of getting my footing in the area.
Yeah. But I mean, I think what I've come across, not only with trying to do podcast interviews with regard to like the subject of chronic pain, is that even the experts who do know the experience through their own diagnoses or experience with chronic pain don't like talking about it. They don't like talking about their personal journey, because my story is that people want to be like, well, are you out of pain? Did you figure it out? Are you cured? And if they don't say yes, then maybe people will think of their research or study or therapy as invalid or not helpful. So what was kind of like your thought process of ever being public or sharing that you are, you know, a baby pain psychologist, soon to be adult grown functioned, fully mature pain psychologist, and your own kind of diagnoses?
Yeah, I mean, in starting to learn everything that I could about everything that I'd been told by my providers, and like what different modalities existed, I saw something very similar. You know, I'd be reading books by people who were physical therapists and medical doctors and therapists themselves that had like maybe a foreword that said like, oh, well, I have a history of chronic back pain, but it was like a few paragraphs. And then it was just, this is what you should do. And I was looking for more of that empathy and validation in terms of this is what I'm doing and this is what it's actively like for me and how it changes as I kind of go through life and different things happen. The weather changes, people contribute to my stress. Yes. Like there are things that like, it's not stable. Yeah, and right. So it's not, you know, to have the expectation that things are going to change and you might have an increase and decrease, kind of a roller coaster of stress and therefore pain, wanting to just be more open about it myself to hopefully connect with those in the pain community, whether it was just on a more like community level versus me and as a provider and someone else as a client, because I think that just fills my cup and hopefully helps fill others as well.
Yeah, because it is like, you know, I find it easier to relate to a doctor if they are open about their experience with it, and also being open to what works for them might not be working for me, which is something I have also seen in the pain community where they're like, this is what it is and it will work. It's science. And I'm like, okay, well, it makes me feel bad. Like maybe I'm not doing it right, which is what I find so interesting about pain PRT or pain reprocessing therapy, which I'd love to kind of dive into, share about our like crossover together. I remember, I think we were DMing once that we were both reading The Way Out by Alan Gordon and Alon Ziv, and they are kind of, I don't know, the faces of making PRT normalized and shouting from the rooftops about it, starting, you know, a curable podcast called Tell Me About Your Pain. All sorts of other resources that they've provided. So how did you hear about it, and what was your first thoughts of what PRT is, and how do we explain to people what that is?
Sure. I think I was just reading all of the books written by all the people from all the places about all the pain. And I stumbled onto this like specific type of therapy, which intrigued me. I was like, oh, this isn't just somebody who's saying, this is what I did and this is what's helpful. This is someone who said, we created this modality of therapy. It's being implemented, researched. They're finding positive results with certain types of people who have certain types of pain. And so, you know, I'm a perpetual learner, and I went online and saw that they had this training, and, you know, other people were talking about it. You had been talking about it on your podcast, and I was like, all right, I might as well go for it. It's a 1 month of intensive training. It was over the summer, so before all of like my teenagers and kiddos clients go back to school and things amp up again. And so I just went for it. And in terms of how to explain it, they use the term neuroplastic pain, which they're using to describe kind of those pain danger signals that are activated in the body that cause uncomfortable physical sensations in the absence of structural damage. And so that would be, you know, a way that they would describe it. So when I was starting the training, they give you all these articles and videos to watch through a week, and then every Sunday you meet with some of the leaders from the Pain Psychology Center, and they kind of go through everything with you and teach you how to do all of the techniques, and we break off into little groups and practice and analyze case vignettes and things like that. But on the first day, someone did ask, oh, what about, you know, trigeminal neuralgia? Does this help that? They were like, no. And I was like, oh, awesome.
You're kidding. Someone asked that? Oh, fuck.
Yes, I couldn't believe it. That's like a pretty random question, I think, just based on the number of people who have TN or are wondering about it. And so, someone like typed in the chat, and I was like, oh my gosh, this is so cool. And they were like, no. Absolutely not. So it's more for, they're using their studies. No. I was going to say that's news to me, because I've heard guests that come on their podcast that will like throw trigeminal neuralgia in the mix of things that can be neuroplastic. And I'm like, oh, okay. Can it be both? But like, what are you meaning that, or you're about to say, what does it help with? What is it more studied and trialed with? So I'm wondering if maybe they were using TN as one of their many diagnoses, because, you know, as you learn about the brain and how it impacts, you know, this biopsychosocial model that a lot of people talk about within the mind-body field, that once some part of your body is activated and the whole body becomes sensitive, and then other parts of the body that may not have structural damage may start to hurt and cause this pain that may linger and eventually become chronic. So I'm wondering if maybe they were thinking of it and bringing up TN in that way. But there is, you know, there's structural damage with TN. And so they answered that question as like, no, it's not really used for TN. It's more used for chronic migraines, fibromyalgia, chronic back pain. Almost all of their studies are with individuals who have chronic back pain. And you can have, it can be both, right? That's what you said. Like it could be structural and non-structural. You could have a disc bulge in your back that, if you take 50 people with the same disc bulge, maybe half of them are experiencing this chronic pain and half of them aren't. And so they're exploring what is it about each of those groups that makes them both more sensitive to that pain and more able to tolerate that pain. And can we facilitate more management with the people who are more sensitive with something like PRT? And they are finding success by, you know, implementing PRT with those individuals. But it's more the idea that once, the alarm bell goes off in your body, the rest of the body is kind of like, wait, what's going on? I just was reading a book by, I have it right here, Adrienne Lowe. It's really awesome. It's called Why Do I Hurt? Aww. And it's like a really amazing breakdown of like relatable metaphors for how to explain pain to just like your everyday person. And they use like the nosy neighbor analysis. So like if there's an alarm going off in a house in the neighborhood, the longer it goes off, your next door neighbors might be like, what is that sound? What's going on? And they come out and they want to look and they get a little stressed out and nervous and they're like, should we call for backup? Is this being handled? And the longer it goes and the louder the alarm, the whole neighborhood turns on their lights. And I'm like, that's so genius. That's like a genius way to explain it. So I have like a little issue in my lower back and sometimes it feels better and sometimes it doesn't. But when I'm in a TN flare, my whole body hurts. Yeah. And so I then have to wonder, which is, one of the positives and negatives of PRT. I start to doubt whether or not I'm contributing to this pain.
I'm glad you brought it up.
I have the power to do something about it, and also I'm the one doing something about it. So where's the balance? Yes. Especially with people in chronic pain who already have a mistrust of their bodies, already connect their bodies to this feeling of shame and guilt. There's like a sense of betrayal that our bodies aren't doing what they should be doing. And how can we trust that by investing our attention into, these vessels, that's going to be a good thing? Because for a while, it certainly has not.
Right. Yeah. And you brought up so many good points in what you were just saying. Like the first being that so many people don't know even the difference between structural and neuropathic. And then we label structural as valid and neuroplastic as your imagination. It's made up. It gives you a super big sense of gaslighting yourself. It also makes a lot more self-blame. And it's not something our doctors ever tell us about, at least in my experience. And our like physical medical doctors, like our, I don't know, my neurosurgeon or my oral maxillofacial surgeon. No one was like, this is what could happen with neuroplastic pain. And instead, they don't really, like, I feel like they know, but they don't know how to explain it in a way that is useful. Instead, we get things of like, you just need to rest. You need to have a glass of wine. Your stress levels are too high. Like, there's no acknowledgement that pain, that neuroplastic pain, is just as real as structural pain, which is, when we think of structural, we think of something that's like physical in the body that is damaged, changed, stretched, whatever, that is causing signals of pain. Yes. And then our neuroplastic is, you could even have a neuroplastic pain in a place that is structurally damaged without it being structural pain. So that's like, I don't think,
100%.
And maybe that was just such a brain vomit for so many people, but that was what I was trying to get across.
Yeah, no. And that is something that I was faced with during the training that you can have. I was trying to understand, like, is there a list that I can look at that says, like, this is neuroplastic and this is not? And they're kind of like, well, it could be both. Like, you could have an injury to your back, but that injury, in theory, heals. And whether it heals over time or with injections or physical therapy or all of the above, it shouldn't linger in the intensity and frequency of pain that you're experiencing. And so now we have to wonder, is it in fact neuroplastic, even if there was an original structural issue? Because in one of the ways they assess whether or not it's neuroplastic pain, one of the criteria is like, well, did you just like bend over to tie your shoe and then all of a sudden you had a big pain like shoot up your back? Because there's no real injury there. There doesn't seem to be structural damage kind of attached to that injury. And they'll say other things like, is your pain symmetrical? Is it inconsistent? And is there like a delay from something that might have actually caused an injury to when you start to feel the injury? Do you have certain personality traits? Is there adverse childhood experiences? All these things. But then they have things, those all make sense to me. Then they have things like, is it based on things outside of your body? And one of their examples is like weather and like barometric pressure and changes of the seasons, because that means it's neuroplastic pain. And I'm like, wait a minute.
I love this one. I talked to my PRT therapist about that. I was like, y'all be having messages out there that it's neuroplastic, that weather doesn't actually physically do anything to us. But then outside of the PRT community, everyone's like, no, absolutely it does. So help me understand, Dr. JAIMEE.
I don't know either. I think that PRT, as I see it, is a great tool, and I love so many things about it. And I think it's also a great way to like look at the ways that they approach certain things and the way they communicate their techniques and their ideology in a way that I might leave to the side and incorporate other things. And when I was in the training, the leaders of the training kind of followed suit. They weren't saying, this is super dogmatic. This is not going to be the only thing that you should use. You should kind of take what you love from PRT and sprinkle it into your practice as you see fit. Because there are lots of articles and research and individuals, providers that I have that I trust with my life that, I'll walk into a physical therapy office and say, like, it's, in New York, it just got cold. Yeah. And my face and my back are feeling it. And they're like, that makes total sense. And I'm like, yes, it does. Thank you so much for validating me. Yes. And like, check in the Dr. JAIMEE category, X in the PRT category.
Right. And I think that that's like something worth noting too, is that emphasizing it's not the end all be all, it's a tool. And now that people kind of understand exactly what it represents, so neuroplastic versus structural, that's like the idea behind it. I'm sure people are going like, yeah, but what is the actual treatment? What's the secret thing that you guys are talking about? And something that I found fascinating with you and I is that like I was going through PRT therapy as a patient as the same time as you were going through the training. And so, I mean, I haven't talked about my PRT experience really. I was saving it for the book, but I brought my like little worksheets and stuff that I did during that time. But how do we explain what the actual process of PRT is? Like, how do we get there?
You got it. So one of the major techniques of PRT is somatic tracking, and that is attending to the physical sensations in your body through a lens of openness and curiosity and not through a lens of fear. Because one of the main ideologies of PRT is that pain is just a fear sensation, a fear hallucination, they said in one of their trainings that I wrote down. I was like, I had a column of like the things I really loved that I would use and the things that I was like,
I gotta see that. I gotta see that spreadsheet later.
And I will send it to
Send that to me. Yeah.
For sure. But somatic tracking I think is really amazing. I use it on myself. I use it with my clients who are in pain, my clients who are anxious, maybe having panic attacks, because it is a way to kind of redirect your attention inward in a way that communicates that you are safe. So they do things like safety reappraisal as you're kind of monitoring and exploring those sensations, reminding yourself that you're okay, that there isn't anything wrong, that your body is just communicating feelings to you without any danger at all. There's positive affect induction, so you're kind of combining positive imagery and humor. It is like a fairly light easily guided technique. It's, I can walk a client through it a few times and then we kind of settle on an imagery that works for them. Even my teenagers really respond well to it. But not everybody is ready to turn inward and connect to those physical sensations because, we've been in pain for a long time. And
where would we be?
Taps back into, right. It taps back into this idea that I don't think is explored enough in PRT or talked about in general by providers, but just like this feeling of mistrust and betrayal that we have with our bodies after being in pain for so long. So I think leaning into positive sensations. So mindfulness is a big part of PRT and breathing, which, some people will roll their eyes and say like, you want me to just take some deep breaths? That's how you want me to like lean into this? I get it. And also it can be kind of powerful as you start to make your way into somatic tracking, because you're not just taking deep breaths. The point is not to breathe in and out. The point is to engage in an activity in your body, knowing that there is some kind of connection to your brain so that you're now experiencing your physical sensation through a lens of safety. I can breathe and feel okay. I can attend to my breath and I am safe. So maybe I can work my way up to paying attention to my face or my back, because now I know that it's possible to pay attention to just these physical sensations in the body that are being generated for a very real reason and are 100% true and valid. And also, I can be okay.
Oh, Dr. JAIMEE, I feel like I'm going to have to come to you as a patient after this episode, because you explained it so eloquently and quickly and beautifully in a way that I don't think my therapist that I did PRT with was able to do so well, which we'll go into my experience real quick, though. We got to throw it to a break. Yes, so we will be right back after this message. I accidentally played the outro part of that twice. We're just going to roll with it. What a great message. What a great sponsor. Okay, back with Dr. JAIMEE here, talking about PRT. I like I said, I've got some of my exercises here, and I want to talk about, somatic tracking. Like I have a script that they gave me that I take, I read whenever I need to. It's very much about, some of my favorite lines that I've highlighted are, let's take a few deep grounding breaths, which I was laughing so hard when you were talking because I used to be so anti breath work. Because it relates back to my triggers with anxiety and panic attack, that paying attention to my breath used to trigger me into messages of unsafety and having a panic attack. I wasn't like, oh, I can breathe, therefore I'm okay. I was, why am I breathing weird? Why is my heart beating this way? How do my lungs work? Yes, panic attack. Bringing your attention to the physical sensation. So actually going towards, what I label as pain. They say it as physical sensation, which I really loved. Kind of like that reframing was like, it's just a physical sensation. We label it as painful or not. Even though it fucking hurts, it's still just a physical sensation. Is it widespread or is it localized? So kind of like you mentioned, sometimes we feel a pain one way and then we can feel like moving into our shoulder or down our hands, into my fingertips, behind my eyes. The neutrality of these statements. So remembering during somatic tracking that you're not trying to change anything or figure it out. You're becoming this third party observer. And reminding yourself about messages of safety and that your goal is just here to simply to watch. And so I wanted to go over what I found to be my biggest takeaway from PRT was actually building my own safety messages, which it all sounds so preschool-y. It all sounds so simple, and I get angry because I'm like, how much money am I paying when I could just be making up messages of safety? So here we are, confidants, giving it to you for free right here. Me and Dr. JAIMEE teaching you how to make messages of safety. So how would you describe what messages of safety are?
So, well, I'd be curious about your specific messages of safety, but I guess for me, that safety reappraisal is again like allowing a person to just explore their physical sensations, even using what we might deem negative words, like it's a sharp stabbing pain and it is radiating through this part of my body, and just being with a person who's just with you, nodding along like, okay, thank you for describing it in that way, as to not set off alarms like, oh my God, it's throbbing and radiating through your whole body. It's, again, communicating that this is okay. It's great to talk about. You're allowed to explore it openly, and you are safe while you attend to these physical sensations.
Absolutely.
So I'm curious about the safety messages that you use that you find to be most helpful.
Absolutely. And what I like about not only this, but the somatic tracking exercise is that it definitely, it's something active to do during pain. Whereas like hearing that you just need to stress less or blah, blah, blah. I was always like, yeah, but I need fucking tools. I need something I can physically do. Like, give me something physical. So I really liked this activity because I don't know that like these aren't typical messages of safety that I saw like in the book. You know, a lot of them are like, you are safe, you are enough, like, you know, so we're going to get a little specific here. My first one was Kelsey's messages of safety is people have gotten out of chronic pain before. And I wasn't sure about it at first because it makes it sound like there's something I don't have, but instead I started to feel like it was more of a manifest of like, I'm going to believe that I am one of those people who got, you know, those miracle patient and miracle cases that you hear where people just no longer feel pain. So I gravitated towards people have gotten out of chronic pain before. Pain doesn't need to be judgment, which goes back to that neutrality. So if I'm feeling something like right now, even every time I podcast, I start to feel my anesthesia dolorosa in my chin. That's without fail. Headphones was a big trigger for me. That was something I wanted to work on with my PRT. And as soon as I feel it, I go, oh God, it's here. I still have another 20 minutes where I have to talk and pretend like it doesn't hurt and where I can just smile and blah, blah, blah. And it's so, the initial reaction is so aggressive. Instead of just going, pain doesn't need to be a judgment. It doesn't need to be, this is going to ruin the rest of my day. This isn't going to be impossible. This is going to hurt the entire time. So that was like a good Post-it note moment for me.
Yeah, like a thought challenge, I would say that is
perfect. A thought challenge. It's okay to try and reconnect. So for me, visually, I always imagined that this nerve was injured or cut or disconnected from the right wiring. And so I started to, again, maybe this is like a manifestation where it's okay to reconnect, where I was literally telling my nerves, it's okay to reconnect to its proper synapses. Feels a little magical.
Yeah.
I also used, I love how much success this mouth has given me.
There you go. I like that.
Yeah.
Give yourself the props that it deserves.
Exactly. Like giving myself the credit of, despite this thing, I still have succeeded, which it feels so 99% of the time that I have failed at healing. So remembering that despite feeling like 99% of the time I'm failing at healing something, I've actually had so much success in my life and my business because of my friggin' mouth. Yes. And then my last two favorite was my mind, my body, and myself are all on one team. So getting a little bit of that separation out of the way and saying, no, this is biopsychosocial, right? It's a fun word we all love to say. And then my last one was when my therapist added that I hadn't thought of, but it was, of course I would feel this way. Of course. Like there's just validity into saying, yeah, of course your body would feel this way after insert thing here, either talking or even just remembering the surgery or remembering the healing process. So those are my safety messages. I'm curious your thoughts, and also if you wanted to share any of your personal ones.
Yeah. So what I was thinking about as you were talking about yours, well, kind of, I guess, work backward, the idea of like attaching your synapses again. I always think to myself, like, nerves that fire together, wire together. And so, yeah, you are basically doing that. That is like a common rhyme that, scientists in the field will use. And so basically by thinking and manifesting that you are actually making new connections or reconnecting, there's data to show that that's actually true. And that's what you're doing. So by constantly and repeatedly thinking that and kind of willing that, you are creating new channels, new pathways, whether, the old ones kind of light up again, or they find new ways to connect. That is what's going on. So hopefully that feels validating as you think that to yourself, because you do really have the power to do that. The brain is kind of working in your corner on your team. And then in terms of that thought challenging, that first part, thinking something on kind of that list of PRT notes that I took that ties into this idea of thought challenging, which is very cognitive behaviorally based, which is another modality of therapy in, the pain psychology field, is kind of allowing your thoughts, whether they're positive or negative, to kind of flood through, and then using evidence that you collect, whether it's for or against it, and challenging those unhelpful thoughts, and realizing that, you can face these sensations and not fall apart. Because everything in your body and your brain is telling you that is absolutely what's going to happen. If I sit in this feeling, if this continues, which all signs tell me that it absolutely will, and that like first outburst of like, oh my gosh, I stubbed my toe, is that going to run up my leg, irritate my nerve, cause a spasm in my hip? I'll be on the couch for a week. I'm going to have to cancel my work. Like that's how it is. That is how we think. That's how we've learned to adjust. Taking, safety messages like that and challenging that automatic thought, which again, we can't control. PRT is not going to be able to control it. Nothing is going to be able to control that automatic burst of this is the alarm that's going to go off. It exists in our bodies, whether we want it to or not, but we have the power to, turn down the volume or turn the chime to something that's more pleasurable and pleasant for us. Even if the alarm's going to go off, like, can it be something that's more bearable? Can we observe it from a place of curiosity of like, all right, I can groove to this sound. I don't have to be bothered by it. Like, I can dance to it. It's okay. We can work with this.
Right.
So, I really do like the idea of incorporating a lot of cognitive behavioral therapy into my work as a pain psychologist. And so that's what that makes me think of. In terms of my safety messages, I use less verbal messaging and use more imagery, which I think, again, is one of the reasons I love somatic tracking so much, because it allows for that. You kind of lean into that. And, they, I'm sure, have provided you with scripts of a variety of different images. One of the imagery that they used a lot during our training was that you are just looking into a fish tank and you are watching the fish swimming around. You're following that sensation, like you're just following a little Nemo, and maybe you're appreciating the colored pebbles, and maybe there's a SpongeBob pineapple in the tank, and you've got some glow lights around it for some mood lighting. And I like to just take that as far as I can. And I do like to put some spins on it that a lot of people in the training were like, do you work with kids? 'Cause it feels like you work with kids.
Me as a 30-year-old woman being like, yes, SpongeBob.
100%. It is so. who doesn't want to like get in touch with that inner child? For most of us, a part of our lives that we maybe weren't in as much pain. Like, what's wrong with like adding some of that humor and fun to it to relax? You know, I'm relaxed when I'm in the warm weather on a beach, so I'll say, okay, like we're gonna go into the fish tank now, as you would kind of follow these physical sensations. Now you're snorkeling and you're next to the fish and you're even closer to them, but you're still safe. You could hear the motor of the boat running, and you are protected from the sun because you put on that SPF 100 and you've got the bathing suit that you feel really good in. And oh my gosh, you see the turtle that you've been like waiting to see, and there's no sharks anywhere. There's no danger, and you are safe and you're okay. And you see the guide for the snorkel with like the bright orange snorkel mask. Flag. You can see him. You are safe. And like just incorporating little things that like are silly and make you laugh, but also remind you that you're safe, but you're in it. You're full in it. You're not just an observer of a fish tank. You are in the water. You are swimming. You are next to these fish that you're following. And so I like to use more imagery to communicate that I'm okay versus verbal, because sometimes when I'm in that amount of pain, my thinking is I have less capacity to like reach for those like beautifully curated statements that I know will work. And I've been told will be helpful. I'm like, what were those words? I don't know, but I would really like to be snorkeling on a beach right now.
Ooh,
so let's dive into that.
Absolutely, especially as like if you're
like
a visual
learner.
Yeah. Jinx. I'm actually curious, like you kind of touched on it a little bit before, but as someone who works with like intersectional marginalized groups of individuals or like children that often are already kind of unseen in pain and disability, like how do you see that they are different or similar to adults, and how do we empower them to go up against such a unfortunately ableist like medical system?
Yeah, it's super hard. You know, I first and foremost want to validate them and validate their parents. Depending on their age, they may not have the language or even just like the development cognitively to really fully grasp what they're experiencing or how to communicate it. Just to themselves in a way that they can then better track it, but also to their parents, to providers, to their therapists. And so I think, again, that's where stepping back from the language and maybe leaning a little bit more into imagery can be helpful. But then, you know, there's a lot of similarities. You know, being in pain sucks. And it sucks whether you're 12 or 90. And there's a lot of different ways, because we are socialized to think about pain and talk about pain in the same way that are very common in how we feel hurt, and we automatically go to a doctor, and those doctors have a list of medications and medical interventions that they're going to provide to you, and you might run through them all, and it can be very time consuming and exhausting and very frustrating. And that all those physical aspects then kind of tap into that your mental game. You know, you start to feel moody about it and frustrated and sad and anxious, and that then just like creates this cycle. And so I see a lot of similarities in all of my clients. So trying to kind of meet them where they're at and open, you know, the book to, it's not just medical providers in the sense of, you know, physical therapists and medical doctors that can help. But there is this field of psychology, which does carry this stigma, and a lot of providers in the field talk about it. We're often the last stop after years of being in pain. And no one wants to say or admit, like, wait, I could be doing something like my head that's contributing to this. And I hear you when you say that again gives me the power to do something to manage it better, tolerate it, but like, let me hang here for a minute and like guilt and shame. And so, yeah, kind of just like meeting them where they're at and being with them through that process. And I think being someone who's experienced pain and is usually actively in pain when I'm with them, you know, lends an additional layer of support, because I'm not the type of therapist who's just like gonna be completely quiet about, you know, my experiences as I've kind of navigated it as well. I think it humanizes us as providers to be open with them.
That's massive. And as we kind of wrap up our convo here, I mean, I want to talk to you forever about this stuff because, like I said, I think you did a really good job with your training because you crushed it here. Even I was like, oh wait, I'm interviewing you. I'm not just listening to a speech or like a YouTube video. But if people are kind of hearing this and they are experiencing that feeling of like, okay, I'm ready to do something about it, and I want to learn more about PRT, where do you suggest that we start? Because I know a big part of like y'all's ethos over at BFF Therapy too is like making all of this more accessible and more affordable. And even though there's 1.2 billion people in chronic pain, so very few have heard about PRT. And when they do, it's even so stigmatized, whether externally or internally. So what resources or where to start would you kind of give our confidants listening here?
I mean, you could read Alan Gordon's book. He does go through the steps of somatic tracking and things like that. I do have to say, having read the book and then having actually gone through the training, it is completely different. There is just a layer of like being with another person and explaining it and watching it happen and then going through it yourself. That's different than just like reading words in a text that are explaining like, this is simply what you do. Because, you know, those providers are going to be aware that some of the things do come off as invalidating and try their hardest to be validating to your experiences and your pain. So there, you know, you could go to painreprocessingtherapy.com. They have a 1-hour free training for anyone who is interested in learning about like the basics of the science behind it and some of the things that they do. You know, fortunately and unfortunately, there is this longer, much more intensive program where you could be lucky enough to go to the Pain Psychology Center in California. There aren't really like a ton of off satellite clinics yet. I was looking at like, okay, I live in New York. Like, where can I go for my PRT experience? But the website, painreprocessingtherapy.com does have a list of providers that you can type in, you know, where you are, how far you're willing to travel, and, you know, you can consult with them. And if you're really interested and feel it's a good fit, you know, find a PRT therapist and go through the whole process. So
amazing.
Big fan.
And beyond, like I said, kind of what you do also just with BFF Therapy, you are such a valuable light and resource for us. And where can people find you if they want to know more just about not only PRT, but all of the stuff we talked about?
Yeah, so our Instagram is at BFF Therapy on Insta, and then also J Arnoff if they're interested in just following me. BFF Therapy, we have a website, so you can check out the blog series that I've written on pain. So I have a whole pain series on talking about how to communicate your pain, how to be a listener for people who are in pain. And I'm just doing a lot of collaborations with Jessica from Getting on My Nerves 5K.
Oh, great. No way. Friend of the pod.
Slowly. Yeah. Yes,
oh, no
she's doing
way,
a virtual
Celine.
conference.
Oh my gosh, all my friends.
Yes, so I'm collaborating with her for Slowly as one of their board members, and so I'm just really excited to start that with them. And yeah, just check us out. We'd love to hear from you. We'd love to just
I want to get like I need to get a group chat with like me, you, Jessica, Celine. We're doing it immediately as soon as this is over.
Amazing.
Perfect. Dr. JAIMEE, thank you so much for being here. Confidants, all of that will be linked below. I mean, I know I'm definitely going to read your articles because I just love how you are making it so accessible. So check that off for Dr. JAIMEE.
Thank you so much.
Make sure to check out rating this on iTunes. Make it 5 stars. If it's not going to be 5 stars, don't rate it at all because I am sensitive. And we will see you guys next week. Thanks, Dr. JAIMEE. Bye.
Bye.